Hi everyone, this is Kate Warnock, GuideWell's social media manager, coming back to you live from MetaFuture. I'm excited today to have Mr. Todd Van Tol. He is the head of health services for the Oliver Wyman Group. Todd has a lot of experience with the payers, and Todd, I know you spent years advising payers on how to operate within the dynamic health industry. You help them navigate a very dynamic marketplace. What is it that you're doing to work not just with payers, but maybe even providers to make sure that we're going to be able to deliver the highest, most affordable quality care to the consumers?
Well, you hit the right end goal. The idea of how do we improve the value, the quality of care that ultimately we as consumers receive when we have healthcare needs, when we try to manage our health, when we have to access the healthcare system. I think as I think back over the past decade plus, and even start to look forward, the challenge has become payers and providers have traditionally existed in a fee-for-service environment and a very contracted relationship, a relationship built around what's the unit cost price, how do we negotiate the cost of different services, with no real sense of how do we create a care environment, an ecosystem that best supports the consumer. It has been one of payers and providers almost trying to decide how to best navigate a zero-sum game of if I pay you more, I have less at the end of the day for a basket of services that the consumer needs, and thinking more broadly around this is a team sport. So the payer has a role in what they can deliver. It is not just the financing of healthcare and constructing a stack of benefits. It is things like care managers, helping people understand which providers are right for their situation, helping them understand their financial exposure, helping them make good choices about when they receive care, where they receive care, etc. And partnering with providers in a way that historically perhaps has been scary to them, to say, we actually need to share data. We actually need to partner. There are pieces of information that the payer has about the consumer over an extended period of time across different providers, across a trip to the hospital, but also in terms of the specialist, the visit to the retail pharmacy, that they can bring together and share with the provider, share, for example, with the primary care physician, and think about ways in which to better coordinate and manage that experience for the consumer so that they get value. And if we think about that relationship in terms of silos, and my strategic advantage as the payer is I need to hold that data and not share that data. And I need to contract with you in ways that optimize my economics and not what we can deliver collectively to the consumer. That results in the suboptimal experiences, the suboptimal quality, the lack of value that we've had in the healthcare system, and we need to break down some of those walls. And that requires a change in what that payer and provider relationship has been, and thinking more around how do we design to the end consumer as opposed to how do we negotiate each of our strategic control and advantage.
You know, we had an executive over at GuideWell explain that, you know, the relationship has really been, let's put down the hatchet, and we're at the table together, and our end goal is really to best serve your patient, our consumer, and if that's the focus, I think everybody wins. So, you know, in this new collaborative, you know, environment that we're in, there's obviously still some consumer needs not being met specifically by the payers. In your opinion, what are some of those needs that aren't being addressed?
Oh gosh, when we think about the complexity of accessing the healthcare system, when we think about how emotional and personal health is, and when we need the support of professionals and physicians, and accessing, you know, institutions of care, that we've made that too complex. As payers, we have allowed ourselves and the clients I serve at times to be viewed as gatekeepers, as frustrating the ability to get the care that people need, as opposed to let me be your advocate, let me be your guide to accessing that system, to not only understand what your health needs and aspirations and concerns are, but when you need to access those institutions, helping you make good choices, helping you find the provider that's right for you, helping you make choices around where you go to receive certain types of care, helping you navigate what will be an increasing number of options that people will have around a retail clinic, telemedicine, et cetera, and then certainly helping you trade off and understand the financial consequences or implications of those choices so that you can best spend your healthcare dollar. And payers have struggled to be positioned as that type of consumer advocate. And it's a tremendous opportunity. It's one that, frankly, I think we have not served the end consumer well by layering on the terminology that we utilize, the way in which we have structured communications and touch points, sometimes for regulatory and compliance reasons, but often we've just made it harder to be a good healthcare consumer, and I think in the process have lost an opportunity that can yet be captured to earn the trust for being that advocate and for being that support for when you need it, both in terms of your daily lives and staying healthy, but when you do need to access care at periods of time of stress, et cetera, and being somebody that's trusted to be that role.
You know, I'd like to build on that a little bit. I think the trust that you mentioned, if a consumer sees that my payer is now working closely with my doctor, I think right there you have a better foundation for that trust, and there's going to be more willingness to perhaps listen to, a payer or care manager suggest that, for this particular procedure you might want to visit this doctor because we work with your doctors to know what's best for you. So I think that makes a lot of sense. Another trend that I think we're seeing here, and it will certainly be discussed more at MetaFuture, is the role of workplace wellness. We have employers who, is there that natural tension where they want to offer their employees the best possible salary, the best possible benefits. It's hard sometimes to offer the best of both.
Yes.
So what is it that you see as far as the workplace wellness programs? How is it that that's going to enable employers to really give their employees, those preventative health measures and keep them healthy, which in turn gives them more leverage to offer perhaps a better salary as those healthcare expenses come down?
Yeah, I think what's important from the thinking about wellness, worksite wellness, is we've defined it in a pretty narrow sense in terms of the value it creates and the purpose of that investment. If our goal is simply to invest in worksite wellness programs and opportunities because we think that's going to reduce in-year medical cost, that's probably a pretty tough challenge. It's probably a pretty limited game. But if we can reframe that dialogue and discussion, I think many organizations are doing this, and saying an investment in wellness is not just an investment in hopefully reduced medical costs. It's an investment in the health of my employees, their productivity.
Sure.
It's going to help them be more effective in their jobs. It's going to be help them have less absenteeism or presenteeism. Also, the right type of workplace or worksite wellness environment is important from a talent attraction and development and retention point of view. These things are all much more difficult to measure than what did my employee benefit cost this year, and that makes it harder to figure out what the elusive ROI is on that worksite wellness investment. But I think it is critical that we frame it against a broader scorecard that includes these other dimensions that really a well-structured wellness investment can mean in terms of your competition for talent, your development of that talent, and the productivity of that talent in your organization.
So you've touched on a lot of the major themes that I think that will be touched on here at MetaFuture. In your opinion, what do you think is going to be the major takeaway for folks attending this prestigious event?
I used the term earlier in terms of payers and providers saying it's a team sport. And if we can get out of our silos, there's better solutions, there's better outcomes for the consumer. What's wonderful about this environment is it's an ecosystem where there's the opportunity for different people working, whether it's in different parts of the healthcare value chain, different geographies, or different consumer groups to come together to share those ideas, to hopefully form relationships that create opportunities to synergistically work together. I'm very much a strong believer in the answers are out there. There are great models that are in place today that are delivering wonderful outcomes and great value and high quality. they just are not at scale, and they are just not completely available to all the populations that we ultimately would like to make them available to. So this type of environment and finding the opportunities for not just the large-scale incumbents, but also the new innovators bringing new solutions and value into the marketplace to come together and find a better path forward, and really having the opportunity to take the innovations that are being done today and scale them and make them available to larger audiences. That's a big outcome of an event like this.
Well, I think what you've shared with us really helps to frame up what we expect to hear more of from our live interviews at MetaFuture. We have up next Suresh Kumar, one of your coworkers, and another Oliver Wyman thought leader that we're just so excited to hear on camera what we're going to hear over the next couple days. So, Todd, thank you so much for your time today. Thank you for visiting us here in the GuideWell Insights Lounge. And this is Kate Warnock. I'll be seeing you soon.